October marks the Breast Cancer Awareness Month, a global campaign dedicated to raising awareness and stressing the importance of early detection, accurate diagnosis, and support for those impacted. This annual initiative reminds women to prioritize their health by scheduling mammograms, learning about self-examinations, and understanding their personal risk factors. It is not just for those over 50 years of age. Younger women need to be aware too, even if they think they are not at risk. But what exactly is breast cancer and how can it be prevented? Breast cancer occurs when cells in the breast grow uncontrollably, forming a tumor. It can develop in various parts of the breast, usually starting in the milk ducts or milk-producing glands. Unlike benign lumps, these cancerous tumors can spread to nearby tissue or even other parts of the body in a process called metastasis. There are 3 different types of breast cancer. The most common is invasive ductal carcinoma or IDC, which starts in the milk ducts and can spread to surrounding tissues. Less common is invasive lobular carcinoma or ILC, which begins in the milk glands. Some forms of breast cancer are more aggressive, like triple-negative breast cancer, which lacks 3 common receptors and is harder to treat. Now let's dive into what increases the risk of developing breast cancer. The causes are complex. Genetic factors, like mutations in BRCA1 and BRCA2 genes, significantly raise the risk levels. A family history of breast cancer, hormonal factors like early menstruation or late menopause, and lifestyle choices such as low physical activity and high alcohol consumption can all contribute to the risk. It's a lot to consider, but knowing these risks can help guide preventive steps. Spotting the early signs of breast cancer is the key. These can be subtle but life-saving: lumps, changes in breast shape or size, unusual nipple discharge, or skin dimpling.
Now, the most important question is how we as an individual can look out for the signs and symptoms of breast cancer that will help us for the early diagnosis of the disease. You can do this by self-breast examination. The first step of it is you'll stand in front of the mirror with both your hands on your hips, firstly, and secondly, you'll raise both your hands above your shoulder. Now, what will you look for? You look for any change of shape, size, or color in both of your breast. You look for any puckering or dimpling of your skin around the breast. You look for the position of your nipple. Is it at the normal position or is it diverted from your normal position? You will also see if there is presence of any discharge from your nipples. And the most important thing is you look for any lumps or swelling in your breast. You can do this with the help of your pads of your fingers by moving them in a circular motion throughout your breast. Now, what should you do if you find any of these changes in your breast? The first thing is do not panic, because most of the times these signs and symptoms are not dangerous. This can be due to normal hormonal changes or due to any other benign causes. So if you find these changes in your breast, please do not hesitate to call your doctors and tell them about your signs and symptoms.
Breast cancer can affect women of any age, and the statistics show just how widespread it really is. The American Cancer Society estimates that 1 in 8 US women will develop invasive breast cancer during their lifetime. While most cases occur in women over 50, approximately 10% of new cases impact women under 45 years of age. This highlights why regular screenings and education are so crucial. According to reports, in India, where breast cancer accounts for about 25 to 30% of cases among women, the median age is even lower, between 42 to 45 years. Sadly, nearly 90,000 lives are lost each year in India to breast cancer. These numbers show why awareness and early detection efforts are so important. It is not just women who are at risk, men can develop breast cancer too, though it is less common. But around 2,700 men are diagnosed each year in the United States of America. Yet awareness among men remains low, leading to delayed diagnosis. Early detection for men can make a significant difference, just as it does for women. But what can be done to reduce these risks? It starts with adopting a healthier lifestyle, eating a balanced diet, limiting alcohol, and exercising regularly. For those with higher genetic risks, preventive options like mastectomies may be recommended. Regular mammograms remain essential for women over 40, while young women can stay vigilant through monthly self-exams. Some celebrities have turned their personal battle with breast cancer into public advocacy, offering hope and inspiration. Tahira Kashyap, a film director, shared her experience with mastectomy and chemotherapy openly on social media. Her courage to speak up has inspired many women to be vigilant about their health. Sheryl, the Grammy-winning country singer, was diagnosed at 44 in 2006. She used her platform to raise awareness and encourage women to get screened. Galinia Rancic, an entertainment reporter, underwent a double mastectomy after an early-stage breast tumor was detected in 2011. Late Maggie Smith, renowned for her role in Harry Potter, faced breast cancer at 74 while filming The Half-Blood Prince, and her resilience shone through her battle. Robin Roberts, a beloved television broadcaster, shared her journey with breast cancer, reminding everyone that early detection can save life. Breast Cancer Awareness Month is more than just a campaign, it is a call to action. It's about honoring survivors, supporting those currently fighting, and remembering those we have lost. But above all, it is about spreading knowledge and hope. Early detection can save lives. So take a moment to schedule that checkup, learn the self-exam, and most importantly, spread the word. Together we can work toward a future where breast cancer no longer poses a threat. Bureau Report, India Today Global.